6:49 right now. The #1 risk factor for lung cancer is smoking, but there are other risk factors as well. One of them is just being female. Dana Reeves' recent death has more women talking about it.
Millions of Americans smoke, and many are trying to quit.
Quitting smoking was very difficult for me, and that was one of the most difficult things I did.
Dorothy Donaldson was in her 20s the last time she picked up a cigarette. Now 51, doctors consider her a non-smoker with no increased risk of lung cancer.
Lung cancer just kind of took me for a loop.
The spread to any of the lymph nodes. And
last September, her doctors found a mass in her lungs.
You can see it's a fairly large tumor.
Dr. Timothy Oakes removed the tumor from Donaldson's right lung.
She's gone through her chemotherapy and has done very well with that. And we expect that she would have a good long-term survival from this.
Though pleased with her treatment, Donaldson didn't understand why she, a 26-year non-smoker, was going through all this.
We know that there is a population of patients out there who never smoked, who don't realize that they're really at risk, and still can get lung cancer. And women in particular can get a kind of lung cancer called adenocarcinoma.
In fact, the type of cancer Donaldson had is often associated with non-smoking women.
When you take all women who come with a diagnosed lung cancer, maybe 1 in 5 will have no smoking history.
It was a wake-up call for Donaldson in more than one way. She wants others to know anyone can get lung cancer. And she wants people to think before they ask the question, did you smoke?
People who have lung cancer, whether they smoked or not, they really ought to be treated with compassion rather than judgment. And that question alone can come across as judgmental.
Something she says she still has to remind herself.
Doctors treated Donaldson at Wake Forest University Baptist Medical Center's Comprehensive Cancer Center. Now, her cancer was in a very early stage when they found it. As lung cancer progresses, it is more difficult or even impossible to treat with surgery. Learn more about the center in the To Your Health section of our website. Meantime, if you have an idea for To Your Health, you can send me an email. The address rosemary@wfmy.com.